Assalamu alaikum, hello and welcome to The Health Show here only on the Islam channel with me, Alistair Greener. As you know, every week we're joined by a health expert within their specialised field who discusses prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, we offer an alternative viewpoint from our health experts who attend the show to help guide you in the right direction. And if you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. Now today we're looking at breast cancer and the support available to those who suffer from it. Macmillan Cancer Support is a UK charity with the ambition to reach out and improve the lives of everyone living with cancer and to inspire millions of others to do the same. From the organisation, we're delighted to be joined by Dr Vaibhav Mathukia. Now, Dr Mathukia is a practising GP in Redbridge who also works with Macmillan Cancer Support as a Macmillan GP. Now, Macmillan GP is very much a clinical professional-facing role rather than a patient-facing role. That said, Dr Mathukia has considerable experience of treating patients who present with cancer symptoms or are cancer patients going through treatment, which is all part of the experience that he can draw upon. He also plays a crucial role in training fellow GPs on the latest cancer policies and best practices. Dr Mathukia, thank you very much indeed for coming into the show.
Thank you very much for having me.
Lots to talk about, so I'm really looking forward to finding out a lot more. But before we talk more with Dr Mathukia, we're going to first look at a short clip where Angela, a Macmillan breast cancer nurse specialist, offers continuous care for those on their cancer journey. She offers emotional and practical support for the family as well. So let's take a look.
My name is Angela Sheldrick. I'm a Macmillan breast cancer nurse specialist. I've been in post for 12 years and I work at Milton Keynes NHS Trust Foundation Hospital. As a Macmillan nurse, we're able to offer continuity of care. We get to know women right from the start, from diagnosis, during their treatment and at follow-up. When a woman or a man is newly diagnosed with breast cancer, it's a life-changing experience for them and they feel alone and very isolated. And some people are very wary of asking for support. I would encourage them to take that step and to use the service, because although they feel nervous, if they did talk to us, I know they will feel better. Breast cancer is very treatable. The key to it is early diagnosis, so we do a lot of health promotion locally. Anybody can be affected by cancer, but that's what we're here for. We're here to help. Emotional support, practical support. We are there for the patients, but we're also there for their family members. You can come in to see us, you can give us a call. We're there for you.
So, Dr Mathukia, it's great to see that video. That gives us a real idea of the support that's available. And things have really changed, haven't they, from the days when we saw any form of cancer as something really serious, potentially fatal, and a lack of support. Things have changed a lot over, say, the last 20, 30 years, haven't they?
Absolutely. When we think about cancer, we really have changed how we think about it. And we believe the story of cancer is changing. And we have so many more people living with cancer nowadays, so much so that we've got about 2.5 million people currently living with cancer, and we expect that to double by 2030. So it's more, we're looking at it more as a condition that we live with now, as opposed to the old thoughts of, you know, it's a bit of a death sentence.
And looking at Macmillan, you know, the support that they give plays a vital role in the process, if you like, from helping people at every stage of their cancer journey.
Absolutely. One of the main aims of Macmillan Support is to provide an all-round support, and they look at the start of the journey from initial diagnosis to when patients are going through their treatment, but also once they're living with and beyond cancer. And they aim to support the patient and their family throughout that entire journey.
And at what point would people typically come to Macmillan for that support? At what point of the journey is that often the first introduction?
They can really come at any point in their journey. Macmillan has looked at patients when they have their main times of need, and it tends to be at the start of the journey, at the time of diagnosis, but also following treatment as well. So those tend to be quite common where a lot of support is needed for patients.
We'll get into the details of the exact levels and types of support that you offer in a while, but let's look at breast cancer itself. Again, the disease is very, very different from what it used to be, and again, we'll talk about screening in a while, but tell us exactly what it is.
Okay, so on a very basic level, breast cancer is when the cells in the breast tissue, they multiply uncontrollably to form a tumour, essentially, which is the breast cancer. It remains the most common cancer in the UK, and it can affect both males and females.
And when is the normal time when it shows itself? What sort of age group are we talking about?
It can unfortunately present at any age, but as with most cancers, as people get older, they're more at risk. So over 50 and post-menopause tends to be the most common time when breast cancers tend to present.
And when we look at ages, you said it can present at any age, but it's unusual to get it before 50, is it?
Absolutely. It's a lot rarer under the age of 50, but it still does happen. So we still have to be vigilant from 20, anyone over the age of 20, but over 50 is when it becomes a lot more common. So
it's interesting, you said that actually it also presents in men, and that's something that people often wouldn't think would be happening.
Absolutely. I think a lot of people don't believe it can happen in men, but unfortunately it can affect men to a much lesser degree than females, but it can still happen in men, actually.
Now, the detection of breast cancer is something where there's been a massive amount of publicity towards and so on. And a lot of it actually can be done personally. We'll come to screening in a second, but actually for a woman, or for a man for that matter, but predominantly for women, what should they be doing to make sure that they're looking after themselves, to be aware of changes or something that should alert them to getting something checked out?
Sure. So we encourage active, regular checks by all women of all ages. So that means inspecting your own breasts and looking for any changes you may notice. So if you feel any lumps, if you notice any changes in your nipples, if you see any rashes, or just if there's any differences in the way they feel, so any heaviness or any pain as well in your breasts, then we do actively encourage that they go see a healthcare professional to get them checked out.
And as we're always at pains to say here on this particular show, that if people notice any difference, for goodness sake, go and seek medical attention.
Absolutely. All healthcare professionals, GPs included, are more than happy to see any patient with any sort of changes in their breasts. So it's really important, if you do notice anything, that you do go get it checked out.
What about screening now? Because this is something, again, which fortunately for most people seems to be something that people just accept. It's part of their routine. It's something that they're going to be doing regularly. Explain how the screening programme works. OK, so I think it's important to explain what screening is first, is that it's looking for illness in people who are completely asymptomatic. So we're looking at patients who don't have any symptoms, and then we're trying to find breast cancer in this case. And the current screening programme in the UK looks at women aged 50 to 70, and it will send an invitation to all women in that age group every 3 years to be invited for a mammogram, which is essentially an X-ray of the breasts. And it's looking for cancers at a very early stage. And again, that's really what this is all about, because like with any cancer, the earlier you detect it, the better your chance of survival. Absolutely. It's very clear from lots of evidence. The earlier we pick up breast cancer, the greater the survival rate. So much so that if you get a cancer picked up at stage 1, you have a 99% 5-year survival rate, which is pretty much everyone. So the earlier we diagnose these, the better, for a number of reasons. So it's completely normal for any woman over 50 to receive this letter to go for a screening. What about families where there's a little bit of a history, where there's, we've heard about, Angelina Jolie, who, went through, a double mastectomy because it was such a big issue in her family. What sort of protection is in place for those women who feel particularly vulnerable because of their family history? Sure. So I think if there is a strong family history of breast cancer, it's a discussion you need to have with your GP, because there are certain there's some genes that will lead you to be more at risk of breast cancer, and those particular people do need increased screening,
and may need treatment at an earlier stage. So it's very important you have the discussion with your GP if you have a few relatives who have suffered from breast or even ovarian cancer, because the genes that are involved are very similar, actually.
Actually, talking about genes as well, are there any differences between different ethnicities, your chances of actually presenting with it? Is there more of a prevalence within certain communities?
So there is a slight increased prevalence in certain communities. So the Jewish Ashkenazi population, they are more at risk. But there are certain other ones, but that's the main one that we look out for.
But obviously, essentially, get yourself checked. Now, in terms of people, when they actually have their checks, the process is you go along. How long does it take?
The
actual screening, yeah.
Oh, less than 5 to 10 minutes. It's a very quick process.
And how long before you get the results?
So you'll get a letter in the post within a week or so, actually, informing you whether you need to go back for another consultation or whether everything's fine.
And if you do get called back for consultation, that's something not to be too frightened of, because hopefully it means actually something's been caught at a very early stage, and therefore that your chances of nothing too serious is much greater.
Yeah, absolutely. The first thing I guess we should say, even if you are called back, it doesn't necessarily mean you have breast cancer. It just means we need to do further testing. And so you'll be called back for another appointment where further tests, so something like a biopsy may be performed, which will then look to see what the abnormality that's been found is. And then, if you are diagnosed with breast cancer, hopefully it's at such an early stage that treatment's a lot easier at this stage.
Talk about that whole process. So take us through that whole stage. So you go back, you've had a screening, they found something. What typically then will happen at that secondary consultation? And talk us through that whole process to the treatment that you're likely to undergo.
Sure. So, unfortunately, actually, my mother's recently gone through this process, so it's something I know quite well. But luckily, it was caught at an early stage. So at that point, if you are unfortunately diagnosed with breast cancer, you'll then be directed to a hospital doctor, a consultant breast surgeon, who will review the biopsy results and then determine the best treatment options for yourself. And the treatment options range from surgery to chemotherapy to radiotherapy. It's all very dependent on the type of cancer one has.
And obviously we can talk through those different treatments that are available. And is that the point when it's a really good idea to talk to somebody to Macmillan? And if so, what's the kind of conversation? And what is that initial conversation? How does it take place?
Sure. So I think at any time it's a good chance to talk to Macmillan Cancer Support. But at this particular time, it's definitely a good point because you may have lots of questions. Often people feel rushed when they're with the healthcare professionals, and you might have questions about this cancer, where you go now. You may just need some psychological support. Even family members may be a bit confused about what's happening. And this is where the Macmillan helpline is very useful. But also additional resources is that Macmillan, they provide people with a lot of leaflets, which have a massive information. And these are available in all languages, including Urdu and Arabic, actually. So that could be very useful at a time of diagnosis.
And typically, who's the person you're going to be talking to at the other end of the phone or meeting or whatever?
So if you do call the Macmillan Cancer Support Helpline, it tends to be a nurse, a specialist nurse who has some understanding of cancer and who can then help support you through this.
And then from that point onwards, as you said, the different treatments, typically, sort of how long are we talking about for a treatment from something that's fairly mild to maybe having just a lump removed all the way through to the more, the bigger treatments, if you like? Sure.
Again, as we've said, it does really depend on the type of cancer. But if you are picked up early, it can be an operation to remove the cancer and radiotherapy subsequently to prevent it from recurring. But if, unfortunately, the cancer has spread or is at a later stage, you may need chemotherapy, you may need a hormonal treatment subsequent to the surgery. It really does depend on how far along or what stage the cancer's been diagnosed at.
And we're going to be talking to Sarifa in the second half, who will talk in a lot more detail about her experience and what she went through, which is always better to hear it firsthand. One of the things I know that we get from many of our viewers, there's a lot of concern about, modesty. People feel quite conservative and they feel quite concerned about who's going to be looking after them. What sort of assurances or what kind of help is offered to maybe women who actually would rather just be looked after by other women?
Sure. So I guess from a GP perspective, I can fill you in on that. So we have female GPs every day of the week at our practice, and that's the case at most practices. So you can always request for a female GP, and it's very common in the community that I work in that they will ask for female GPs for such cases, and we'll make sure we try to ensure that they do see a female GP when they want to. And then when you go to the hospital, you can always ask for a chaperone if there aren't any female surgeons available. So I think the healthcare system does try to help communities where there may be a taboo about seeing a male doctor.
We've talked a lot about how important screening is. What do you think prevents people from actually going for the screening? And actually, for that matter, what sort of percentage are we talking about who aren't going for screening? And for those people, what's holding them back?
OK, so I think we're talking probably nationally about 70% are attending breast screening currently. In the Asian community, I suspect that's a lot lower, heading towards about 50%. And the reasons people may not go for screening, there are a few, and I think we've talked about the taboos. Perhaps they're a bit frightened that if they do go for screening, what the results will be. And as we've talked about in the past, people have often seen cancer as a bit of a death sentence, which, again, is not the case. But they worry if they are diagnosed with something like that. Another reason I find is that people don't understand what screening is. They don't see the purpose. So you'll get a letter in the post inviting you for this, but because you feel completely well, you don't feel the need to go. So it's really important that even if you don't feel any symptoms, you still go. And that, from my experience, when I talk to my patients, and I ask, why have you not been? It's because they say, I feel completely well. But the whole aim is to still pick up the cancers at an early stage.
What would you say to someone in that position? It might be somebody watching, or quite often it's somebody who's watching who has a relative or a friend or somebody who says, I've received this letter, I'm not really sure whether I should go or not. Again, what do you say to that? I
would say encourage your friend or yourself to make sure you do make that appointment and you do go, because it could potentially save your life. And evidence shows that actually the breast cancer screening saves about 1,300 lives a year. So it prevents 1,300 deaths. So it just shows the importance of going to the screening.
At Macmillan, you do a huge amount of work supporting. First of all, talk about your role, how you get involved, because you're more clinically facing.
Sure.
So what exactly does that mean? So you're not, although you are a practicing GP in Redbridge as a GP, your role within Macmillan is slightly different.
Yeah, absolutely. So we work with other GPs to educate GPs about the changes in current treatments, current guidelines. We organise educational events. We have a role in the cancer services in the local area. So we work more with other professionals as opposed to patients with regards to the Macmillan role.
Let's talk about more of the services that you actually provide. We talked about quite a few there.
Sure.
Let's say someone's beginning their cancer journey. Talk me through the different things that you can help women with all the way through, because I know it goes all the way through to the, hopefully successful operation or treatment and recovery. So talk us through all of that process and the things that you can help with along the way.
So Macmillan has a wide variety of things that they can help with, and so they have support centres which tend to be located in the hospitals where patients can go talk to nurses or healthcare assistants about the cancer and get some advice and support there. Macmillan, again, has so much information on their webpage. It has lots of information leaflets. It also has the support hotline that we've discussed. So there's lots of things where Macmillan can support you with, and just having someone on the end of a line can be more helpful than anything, and that's what Macmillan aims to help
Absolutely,
with.
And it's certainly when it comes to the aftercare as well, the fact that someone's there all the way through your journey is brilliant. We've already come to the end of the first half. We've got lots more to talk about in the second half, but for the moment, thank you very much. And what we should also say now is that we must stress that should you suffer from any medical problems or have any health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. After the break, we'll be joined by Sarifa Patel and hear her story of a remarkable patient who didn't only just suffer with breast cancer, but now volunteers for Macmillan Cancer Support to support others. We'll be right back. Welcome back to the Health Show, where our topic today is breast cancer. In the first part of the show, we talked to Dr Vaibhav Mathukia, who works with Macmillan Cancer Support as a Macmillan GP. In this part of the programme, we're joined by Sarifa Patel, who is a 58-year-old mother of 4, wife, carer and community advocate. She was diagnosed with aggressive stage 3 breast cancer in 2010, and once diagnosed, Sarifa underwent surgery and subsequently received radiotherapy, which sadly resulted in 3rd-degree burns. Sarifa has also experienced some health issues with medication which was prescribed as part of her recovery. But despite all of these challenges, Sarifa still views her cancer journey as a positive one. Sarifa has been supported by Macmillan in a number of ways, through Macmillan clinical professionals, information and support specialists, as well as welfare benefits advisors as well. They have helped her through her treatment and recovery by providing access to patient transport, emotional and practical support, advice on money worries and benefit entitlements. And indeed, this support continues to this day. Now, before we actually talk to Sarifa, let's watch a short clip where another patient, Della, talks about her breast cancer experience, going through chemotherapy, and now her Macmillan Cancer nurse. Charmaine is her nurse and has helped her all the way through. It's just another example of the work the charity is carrying out.
I first knew something was wrong because my breast was painful, was really painful at night. I couldn't even sleep, and I was self-medicating, taking paracetamol or something for pain. I went in for biopsy and everything, and then I was told it is cancer. I initially had a mastectomy and then I had an implant, and I was told I would need chemo. It's a period I don't even want to remember. You don't even understand where you are, you're tired, you're just all bad thoughts in your head, and why me? I felt alone, I felt lost because I had nobody to call. My Macmillan breast cancer nurse, she was the best thing that happened to me. This is Charmaine Case, my breast cancer nurse at St. George's Hospital. I'm glad Charmaine was in the room that day, because all what those guys were saying, I'm like, okay. You know, a doctor tells you things, there's so much jargon in it, but she broke it down.
I asked her who's at home with her, what support she has, who's going to help her through this. We talked about support groups.
She became my best friend. She was good to me. She was really, really good. There was a time I was so poorly. I said, Charmaine, I thought I was superwoman. I can't do this. And she said, you can, you can, you can. I'm like,
but just
okay.
slowly.
Just slowly. Without Macmillan, I wouldn't have gone this far. You just need a Charmaine around. You need not someone to guide you through. And that's what they're there for. Thank you.
What a fantastic story, and great to hear yet another typical story from Macmillan. I'm sure you have your very own, Charmaine, as well. Sarifa, welcome to the programme. Thank you for joining us. First of all, maybe just tell us your story. What actually happened to you? How did you discover something wasn't right? And then how you found Macmillan and that whole journey that you undertook.
Well, my journey started because for a whole year I was suffering. On my left side, that breast felt different, I felt pain there, and the size appeared a bit different. And I kept going back to the doctor, but because I've got complex health conditions, I thought it was my asthma, and maybe my lungs, so much change is happening there. The doctors actually thought it was my heart because I was under a lot of stress with the 2 people that I care for. So they kept sending me for heart checkups, but I was really grateful to the NHS screening, because if it wasn't for them and if I hadn't gone for the screening, I would not be here today. I just turned 50 and then they sent me a letter about screening, and I went to the screening and they called me back to say that they needed to do biopsies, and from the biopsies they then told me that I had tumours and that I needed to see the breast care surgeon. That was a big issue for me because in our culture we're very conserved, and I think every woman is, quite to be honest, and it was a male surgeon, and I was a bit worried about like showing my breasts and talking about my breasts to a male surgeon. But of course, I was still very confident, so I did. And I said to him, I said, I don't really like talking to you about my breasts. And is there any chance that I can have a woman consultant? But he expressed that there was an urgency for my cancer because we didn't know what stage it was at, and that that would take a few months down the line, and if it was aggressive cancer, it could spread. So then I decided to stay with him. But what I did want to say here is that women do have choices. You can ask for a breast surgeon that's a woman, and that is your right. And to be honest, I think all of this as well, I found out because as soon as I did get diagnosed, I went to my Macmillan drop-ins, and that's where I got more empowerment. So I did want to say that. The thing is, my whole cancer journey was quite interesting because throughout the journey I carried on working. I'm also a carer for my 2 people, and my cancer journey impacted on their life quite a lot at an emotional and psychological level, so I had to make sure that there was enough support for them. Again, Macmillan then directed me. They're very good at signposting people to other places, and they directed me to Sienna, which is a Cancer You're Not Alone charity at local level, and they were excellent as well. They work very closely with Macmillan. What I liked about them is that they used to come to the hospital visits with me, and some of the terminology, you know, if I didn't understand it, they would then express it to me. And then we'd go together to the Macmillan and get a book about it and look into it. So those kind of things really helped me. I found that throughout my journey, and even now, what I love about Macmillan is that they've got social prescribing, and no matter where you are on your step of journey, because mine's now about 8 years ago, but I can still go to the social prescribing if I need to, just to have some time out to think about where I'm going and to have like what they call a holistic needs assessment.
And that's a really nice thing, isn't it, to know that they're permanently there. And
yeah.
I should ask, how are you now?
How am I now? I'm up and down with my journey because through the cancer I also got some other conditions like diabetes. I had a TIA, so I had to stop my treatment as well, you know, the hormonal tablets, because I think they trigger the TIA. So again, my journey is up and down because with every year around Christmas time, something happens to my breast, the same breast that I have the operation on. And then I'm either asked to go to the hospital surgeon again, either because I get a rash on it or either I get an abscess on it or something. And then they want me to stay. But because of my caring responsibility, I couldn't stay. But now, again, with Macmillan's empowerment and the social prescribing, give me time to think about what is it that I need, in my, you know, to help myself. So like a bit of respite for me, a bit of, you know, looking at my journey, where I am, what I want doing. What I did want to also bring about is that I didn't know that cancer was genetic. Through my information booklets from Macmillan, I learnt about that. And that was interesting because I then educated my sisters around it. My other sister got diagnosed with it, and then we were put to the genetic testing. And from there, we found out that we're on the high risk because my auntie also died of it. So now my daughters have to be screened a bit earlier than other people.
Which is something we talked about before.
Yeah.
And the thing I was really interested there that you were talking about was the other levels of support that Macmillan give you. You know, many of us who've heard of Macmillan, we're very familiar with some of the roles that they perform and the support that they give people. You know, if people have heard of Macmillan, they're aware of that side. But the one part that people might not be aware of is the social side that you were talking about, helping you with benefits, helping you with finances, having advice, all of the stuff that basically is always there for anybody who's suffering with cancer, but actually is not the disease itself. It's a consequence of going through treatments. Give me an idea of how they helped you and that kind of support they gave you.
Where I had a child with disabilities, I was quite isolated, and that's where when they signposted me to Sienna, it really helped. The other part of it helped, that service of theirs helped me, was that my dad and my mum had written me off as soon as they had the big C word. And they were in tears every time they'd see me. And I would say, oh, my God, I really don't want this because I'm going to fight it. I'm a fighter and I'm going to come on the other side. And what was interesting is then my dad reached out to Macmillan and they were really good with him and explained that, you know, that breast cancer isn't as dangerous as it used to be. Because if it's caught early, you know, you can live on. And here I am. I'm living proof.
Absolutely, and it's a really inspiring story because at the end of the day, you know, as we found out early on, Doctor, that actually most people aren't going to have such an extreme story as you. But the fact that you've been through such a challenging time and you remain positive. I mean, how do you remain so positive? I'm sure that Macmillan have had a role to play there, but it's quite an achievement to keep bouncing back.
Yeah, the role that Macmillan played for me there was the holistic needs assessment and the social prescribing, and to work with me to give me my time to think what was important for me as a personal goal for me. For me, my goal was always that I'm a nursery nurse by profession. I'm a community development work now, and I work for charities, and I wanted to keep that up. And they give me the willpower and, you know, the motivation to say, no matter where you are, how low you are, sometimes I was very low, that you can rise above it and you can get to where you want to. And the thing is, inner strength really helped, and my religion really helped. I'm a Muslim by faith, and that's another thing that I was always pray to Allah subhanahu wa ta'ala to help me, and He did. And, you know, that's what really got me going.
Let's talk about the other aspect of your life. I mean, you seem to be this incredibly busy lady who has so much in her life, being a carer, you know, working as a nursery nurse and all of these things. And now you've also found room to work with Macmillan as well.
That has been wonderful because it's to reach the other black and ethnic minority group, because the big C word is still a big taboo in our culture. They still see it as a deaf, you know, deaf, and I'd like to show them a positive side of it and said, well, there's more to life even after with cancer, you know, and that's what I try to promote, but also to bring about change that really needs to happen, so that more BME people come forward and use Macmillan services, because it's a really excellent resource in the community, and it's a free resource, and we don't, you know, we don't use it because of all our fears and our anxieties around it. Well, actually, you know, if you put your trust in them, like I did, you can get to wherever you want, you know, and keep on your, you know, positivity and your strength. The other thing I did want to say is they were the ones that understood my caring responsibilities. Sometimes, because of my disability, people weren't understanding my caring roles, but Macmillan again did a big information around carers and that, and they called me in, and they really love what we had to say about being a carer, that when you're dealing with somebody with acute health needs, you have to be responsive in different ways.
And it's interesting, that caring side that you talk about, the holistic view, to use your word. And Doctor, hearing Sarifa, I mean, it's wonderful to hear that level of positivity about it. Obviously, Macmillan give that tremendous support, and people will come out the other side, as Sarifa has. How important is it for Macmillan to have a diverse group of people working with you so that they can show members of their own community how Macmillan can help?
Sure. Firstly, an inspiring story it was, and I think the support she's gained from Macmillan has really echoes what I feel with my patients as well. They have similar stories of the support that they receive in terms of benefits and financial, but also the psychosocial help. With regards to targeting different communities, I think Macmillan worked very hard to try to get into communities, and in my role as a Macmillan GP, I have done talks to faith groups to raise awareness of cancers, symptoms of cancers, and this is something that I think Macmillan is working very hard to, especially as Sarifa has said, there's sometimes a taboo around the topic of cancer, the big C, and actually people aren't aware of what's available. And so hopefully Macmillan can reach different communities to make them aware that there is that support available to them. And
what's the difference in perspective when the advice and the help and the support is coming from a cancer sufferer themselves, someone who's been on the journey? How much value is that to Macmillan?
Oh, I think it's massive. I think, you know, because they can talk about their experiences and what helped them, I think that can only be good. It enables other patients to see how they've come through it, what, you know, what positivity they bring, and so it's a brilliant asset to have. And
what's been the response? You were talking about your faith being very important to you. You're talking about your family, the conversations you've had. What's been the response from people you've talked to who maybe before hearing your story was somewhat reluctant to take part in screening, or reluctant, as so many in your community are, to reach out to external individuals for help?
It's been a really good one, because as soon as I was diagnosed, I went into a big mode of I wanted to change the world and talk about cancer and not let it be a taboo and whatever. And so all my local women who weren't going, I was just saying, look how it saved my life, because my GP hadn't picked up, I hadn't picked up. So, you know, how important that we have this free service and we use it, and how positive it can be if you get picked up early.
And it was interesting, your particular story was exactly what you were saying, Doctor, earlier on, about that, you know, we normally associate breast cancer with someone finding a lump. And this whole thing of, I haven't got any lumps, I'm fine. But actually, you were a case in hand where actually no lump presented. It was purely the screening that saved you.
Yeah, definitely, definitely. And I'm really passionate about making it possible that everybody that has screening, whatever their reason, I think what we've got to bring about change here is that to let people know from the BME community, you can bring chaperone, you can bring friends, family, you can ask for women consultants or people who do biopsies that you'd prefer, and ultimately, that is in your right.
And have that conversation.
Yeah.
And Doctor, coming back to you for a second, you know, I know you have the support centres where people work. Tell us a little bit about who's there and the help they offer, because for some people, they want to pick up the phone. For some people, being face-to-face is important. So tell us a bit more about the centres.
Absolutely. So there's 28 of these support centres in London and 166 throughout the UK, including Northern Ireland. And it's information specialists who tend to be at these support centres, and they can provide you with information about the cancers with a variety of elements to it. So looking at financial help, looking at benefits help, looking at your, you know, and they help to signpost you to other services which are available locally, as I think you benefited from. That can also help you through the journey.
So again, the actual medical element is always going to be undertaken by GPs and specialists. Where Macmillan come in is the support structure. And as we've talked about, you know, the amazing thing for me, I thought I had an idea of what Macmillan did, but all of these extra services that they do, you know, again, using that word that you used, holistic, is a major part. What would you say to someone who's maybe just had that result? They've just found out that actually the biopsy isn't good, and they are lost and they have that initial shock, what would you say?
I would say go to your nearest Macmillan centre, go have a chat with them, have a chat with your breast cancer nurse, and to be honest, for BME community, they worry about the language barrier. Well, with Macmillan, they're really good. They address the language barriers. They have leaflets in different languages. They also, on the phone helpline, will try and get to the language that you understand. And even with disability, I'm a disabled person, and if I have trouble going to any of my information days or where I work for them, they help me with the transport needs, so your access needs, so they're very inclusive.
Is there any individual or any circumstance where actually maybe Macmillan isn't the right route for you?
In terms of
help and support?
I think it offers so much when you need support. So I struggle to find a right time where Macmillan won't be able to help you. But the other thing I want to emphasise is also it's not just for the cancer sufferer. It's important for families of the patient as well. They can use Macmillan and their support services, because cancer doesn't just affect the patient, it affects everyone around the patient.
And that's a really, really good point. Both of you, thank you so much indeed for coming in. I hope that you've inspired so many other people just to reach out, but thank you for the moment. And as we've said, life with cancer is still life, and Macmillan will support you to help you live with it. Right from the moment you're diagnosed, right through to your treatment and beyond, they're a constant source of support, giving you the energy and inspiration to help you back and to take control of your life and feel more like yourself again. That's the Macmillan ethos. And if you or anyone you know is suffering from cancer, then please, please do get in touch with Macmillan for free here in the UK. The number is on the bottom of the screen. It's 0808 808 0000. You can also visit their website as well, macmillan.org.uk. You know what, if you just put Macmillan into your computer, you'll find them. Now, I would like to thank both Dr Vaibhav Mathukia for coming in, and also Sarifa Patel for giving us so much great information and really helpful advice as well, and talking about the different journeys that people are going on. And Sarifa, especially for you, for your incredibly inspiring story, which hopefully will encourage anyone with cancer to reach out and get help and support, because you know what? You're not alone. If you'd like to find out more about this or any of the subjects we cover, then please do, as always, get in touch with us. If you want those details again, you'll find them at healthshow@islamchannel.tv. We would love to hear from you. And remember, you're not alone. Once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show offers you an alternative viewpoint to the health concern being discussed. But for now, it's goodbye from me, and we'll see you again next week. Assalamu alaikum.